Sleep apnea is a serious disease. It's a situation when the patient's soft tissue in their throat collapses during deeper stages of sleep. They're not breathing, and subsequently the oxygen levels in their bloodstream drops potentially to dangerous levels. Sleep apnea has far-reaching effects beyond the respiratory system. Patients chronically can develop hypertension, high blood pressure, cardiovascular disease manifest by heart attacks and strokes. We estimate of the 40 million patients in the US that have diagnosable sleep apnea, we're only treating about 4 million, about 10%. The majority of patients are prescribed a CPAP, which stands for continuous positive airway pressure. As otolaryngologists, we hear day after day about the nasal concerns in our CPAP patients. As we had become more familiar with Nasoclenz in other parts of our practice, before our office scopes, before our office surgeries, we theorized that using Nasoclenz nightly before donning the CPAP mask might be beneficial. Since so many of the deterrents to compliance with CPAP are nasal in origin, we wanted to look at ways that we could make the nasal passages cleaner, more lubricated, more comfortable to see if we could improve CPAP compliance. In our clinical trial within long-term CPAP patients, over 50% of patients demonstrated an increased compliance using their CPAP. 55% of the patients noticed and reported an increase in comfort, less nasal dryness, less nasal irritation while using their CPAP. Over 80% of patients felt that this regimen was beneficial and would be beneficial to other CPAP patients if incorporated on a daily, nightly basis.
I've been diagnosed with sleep apnea for the last 6 years. I've been using my a CPAP for the last 5.5 years. I was having a lot of crustiness in my nose from the CPAP. With the Nasoclenz process and cleaning my nose, I felt much better, a lot more energy. My nose was moist, it wasn't dry and crusty. It was an overall better experience using Nasoclenz along with my CPAP. My regular nightly routine is to put the liquid gel onto the applicator, swab my nose, my right nostril first, put a different applicator and put the gel on the left one and do my left nostril. Prior to the study, I was only getting 4 to 5 hours of sleep time with the CPAP. Now I'm getting anywhere from 6 to 8 hours. Utilizing Nasoclenz has been a game changer for me, and it's something I will be using going forward.